everyone, and welcome. Today, we are diving deep into a medical story that is, and I'm not exaggerating here, fundamentally reshaping our society. We're talking about the GLP-1 revolution. Let's get right into it. So I want you to imagine a specific date with me, January 28th, 2026, because this is the day the so-called incretin revolution really hits a massive turning point. We're talking about GLP-1s. These are drugs that mimic a hormone in your gut to regulate appetite and blood sugar. Now, they started out as a treatment for type 2 diabetes, but they have just exploded into this huge cultural and clinical phenomenon.
But for this revolution to really catch on, it had to overcome one enormous barrier. For years, the incredible power of these drugs was, well, it was locked behind a needle. And for a lot of people, that was just a non-starter.
And the scale of this problem? It was huge. Research shows that up to 35% of the public has some kind of needle hesitancy. Just think about that. That means more than a third of the people who could benefit from this groundbreaking therapy were effectively locked out simply because of how it had to be delivered.
So you're probably thinking, why not just make a pill? Well, it sounds simple, right? But for decades, that was basically science fiction. The human stomach is an incredibly harsh environment. It's a true dead zone for delicate drugs like these GLP-1s. It would just destroy them on contact, making them totally useless. Cracking this code was a monumental bioengineering challenge.
And that brings us back to our big day, January 28th, 2026. Because on this day, that challenge has officially been met. The FDA gives its approval to the very first high-dose, once-daily oral GLP-1 pill, specifically for weight management. It is an absolute triumph of bioengineering. It uses these special absorption enhancers that basically act like a shield, letting the medicine survive that trip through the stomach and get into the bloodstream.
Okay, so the crucial question is, does it work as well as the shot? And the answer is a resounding yes. The data from the clinical trials showed an average weight loss of 16.6%. I mean, that number is statistically right there with the leading weekly injections. It proved that the pill is every bit as powerful.
So this new landscape is a total game changer. Think about it. We're moving from a weekly injection to a simple daily pill and getting pretty much the same amazing weight loss results. But the real story, the thing that gets me excited, is in those emerging uses, treating addiction, chronic kidney disease, even protecting the brain. This isn't just a new way to take a drug. It's like a key that has unlocked a whole new world of what's possible in medicine.
You see, this breakthrough did way more than just solve an access problem. It revealed the true, mind-blowing potential of the molecule itself. And because of that, the conversation has shifted way beyond just the number you see on a scale.
The medical community is really starting to embrace what they're calling the weight plus strategy. The understanding now is that these are not simply weight loss drugs. They're not. They are systemic metabolic stabilizers. The weight loss is just one effect, a very visible effect, of a much deeper, more profound biological process happening inside the body.
So what are these plus benefits? Well, for starters, these drugs offer significant protection for your kidneys. They also dramatically reduce what doctors call MACE, that's major adverse cardiovascular events. The really bad stuff like heart attacks and strokes. And this has officially reframed obesity, taking it from what some saw as a cosmetic issue to what it is, a primary and now treatable cardiovascular risk factor.
But maybe the most unexpected, and frankly the most exciting frontier for this revolution isn't in the heart or the kidneys. It's in the brain. That gut-brain connection is turning out to be way more powerful than we ever could have imagined.
And it all started with patients. People taking these drugs started reporting this strange but very welcome side effect. They would describe a quieting of their inner chatter, a sudden drop in cravings and compulsive thoughts that went way, way beyond just food.
And now, scientists think they know why. It turns out, GLP-1 receptors are also found in the brain's reward centers. It looks like the drug helps modulate, or kind of turn down the volume on, the dopamine spikes that drive all those compulsive behaviors. And the implications of that for treating addiction to things like alcohol and nicotine, they're just staggering.
This brain connection gets even deeper, believe it or not. Some researchers have actually started using the term type 3 diabetes to describe Alzheimer's disease. The idea is to reframe it as a metabolic disease of the brain. Now, this is a really powerful concept because it puts metabolic health, and by extension GLP-1 drugs, right at the center of how we think about fighting neurodegeneration.
And the mechanism seems to be that these molecules can actually cross the blood-brain barrier. They can get past that protective wall around the brain, and once they're inside, they might help reduce the kind of chronic neuroinflammation that's a hallmark of diseases like Alzheimer's. Now, it may not be a cure, but the focus in 2026 has really shifted towards using these drugs for prevention in patients who are at risk.
Okay, so with all of this incredible promise, it sounds almost too good to be true, right? Well, the widespread success of GLP-1s has created a totally new and very practical clinical challenge that doctors are now dealing with every single day.
Here's the problem. When you lose a lot of weight that quickly, you're not just losing fat. Patients also lose a substantial amount of their lean muscle mass. It's a condition called sarcopenia. And this has forced everyone to focus not just on a lower number on the scale, but on achieving what they call quality weight loss.
And this has led to the development of what is now the 2026 standard of care, this muscle as medicine protocol. It's a three-part strategy. Step 1 is, of course, the GLP-1 therapy itself, but that is now always paired with Step 2, a high-protein diet to fuel the muscles, and Step 3, mandatory resistance training to preserve and even build lean mass. This whole package, this comprehensive approach, is now the gold standard for getting healthy, sustainable results.
So that brings us to the really big picture. This whole journey started with diabetes, then it moved to weight loss, then it expanded to protecting the heart and kidneys, and now it's knocking on the door of the brain. It just makes you wonder, if one single molecule can have this much influence on the fundamental pathways in both the body and the mind, what disease of modern life will it tackle next?